The symptoms of tuberculosis are very common and therefore can be confused with many other diseases. So it's very important you seek advice from your GP if you have any of these following symptoms. Number 1. History warns us. Tuberculosis used to be called consumption and was the major cause of death, with Hippocrates naming it the most widespread disease of his age. TB has never gone away and is today one of the top 10 causes of death worldwide. Number 2. Trouble breathing. Since tuberculosis affects the lungs, it makes it difficult to breathe, and shortness of breath is common. As the disease progresses, those with tuberculosis will even find routine activities difficult to accomplish. Number 3. Night sweats. A cough and night sweats are the two most significant symptoms that give the clue to what is ailing you. While these symptoms are typical of TB, they may also indicate other medical problems. Always consult your medical practitioner. Number 4. Loss of appetite. The immune system's response to pathogens is to reduce the appetite in a bid to kill the invader. However, part of the cure for TB is to maintain a good nutritional status, and when appetite is absent, this is tricky. One way is to consume bone broths from good quality sources. Number 5. Traveling or living in other countries. There are 22 countries listed as being high-burden TB areas. And the Bacillus calmette-guerin vaccine, which is primarily used against tuberculosis, is only effective for those in the 16 to 35 age group. If you are unable to have the BCG vaccination, then you must maintain strict hygiene standards and good nutrition when traveling in the high-burden TB countries. Number 6. Substance abuse. Cigarettes and other substances suppress the appetite. Malnutrition causes alterations to the individual's immune system and an inability to fight an infection. A faulty immune system increases the risk of tuberculosis. Number 7. Chronic pain from cough. A chronic cough will also produce pain because of the microbacterium tuberculosis cells adhering to and breaking down the cells of respiration in the lungs. This creates cavities when the sufferer is coughing, which leads to the unbearable. Number 8. Fatigue. Fatigue when you are not well is due to most of the energy in the body going to fight the infection. One of the first symptoms of TB is a chronic cough, and if you have fatigue as well, it is essential you seek advice. Number 9. Fever. Fever, including chills and night sweats, are all symptoms of the immune system fighting an infection. It does not necessarily mean you have TB, but a fever with a cough may, and you would be strongly advised to seek the advice of a medical practitioner. Number 10. Back pain. Back pain is a common problem, but then you may need to see a specialist as spinal TB may be the cause of your back pain. Spinal TB in some areas has such a low incidence it is not recognized by medical practitioners. Do you suffer from any of these warning signs? Comment below.